Why do pregnant women get high blood pressure during their pregnancy, and then their kidneys become damaged and they have to have dialysis throughout the entire pregnancy? Well, it's because they got pregnant. Thanks, man. No, I'm just joking, So this is what really happens. The placenta is connected to the uterus, right? There's these blood vessels that connect the two of them, and the placenta is trying to remodel the blood vessels. Remodel is a fancy word for saying reshape the blood vessels into these huge blood vessels. Why? So the placenta can get way more oxygen and way more blood. That's what the placenta needs. Now, in rare cases, the remodeling doesn't happen properly. Instead of getting a huge blood vessel, they're getting these misshapen or these really narrow blood vessels. Placenta doesn't like this. The placenta is being starved of blood and oxygen, so it gets really stressed out and shoots off all these proteins into the mother's body. So this started as a placenta problem, and now it's going to become a blood vessel problem for the mother, because these proteins affect the inner linings of the blood vessels, especially the small ones, and it causes them to thicken and narrow. And yes, that is a bad thing. One of these proteins is called SFLT1. Don't have to remember the name. This is just an important protein that does a lot of damage. So this is what happens, right? Your blood vessels thicken and narrow, and your blood pressure shoots up, which is very bad. And your kidneys, the glomeruli, the filter for the kidneys, it's affected a lot because it has tiny blood vessels attached to it. Those blood vessels narrow, those blood vessels become damaged, protein leaks in your urine, you're not cleaning toxins like you're supposed to, and you end up getting an acute kidney damage. And you have to do dialysis. So that's what preeclampsia is. Preeclampsia is really high blood pressure because those blood vessels narrowed because the placenta isn't getting enough oxygen in blood, and it's stressed out and throwing these proteins that are causing these blood vessels to narrow down. Now, I know that was a lot, but here's a little bit more. HELLP syndrome, HELLP, hemolysis, elevated liver enzymes, low platelets. That's what it stands for. If the situation doesn't get better, if the situation gets worse, eventually these small blood vessels will cause your red blood cells to burst. Imagine taking a balloon filled with water and trying to push it through a narrow hole. It's going to burst, and oxygen is going to splatter out everywhere. Hemoglobin is going to splatter out everywhere. Your organs won't get the oxygen that they need, which is really bad. Also, your liver. Your liver has these tiny little narrow blood vessels too, and they're barely getting the blood that they need, and they're becoming damaged, and they're shooting out these enzymes, so you have elevated liver enzymes. Lastly, the platelets. Platelets are overworked. They're working their butts off trying to fix all these problems. Eventually, you're going to have low platelets because your current platelets are working too damn much. Now, how do we treat this? Give birth. Because the second you give birth, the placenta's gone, and all those proteins won't be shooting out there anymore. So it started as a placenta problem, became a blood vessel problem for the mother. And like I said before, you can thank your man for that. Take care. Ciao.